in Hubei. Today we invited 3 experts to answer your questions. First, I would like to introduce our 3 experts. Mr. Xu Yong from Hubei's Cultural and Tourism Department, Mr. Chen Zhuan from the Health Commission, and Professor Hu Ke from the Respiratory Department. Now I would like to give the floor to Mr. Xu to introduce the general information. Friends from the media, thank you for your interest in our work in the recent days regarding Hubei's cultural and tourism activities. According to the arrangement, I would like to introduce to you that after the outbreak, I would like to tell you the arrangement of our department's work. First, we organize the meetings regarding the outbreak, especially for the parties regarding to the tourism and the cultural activities, and also make a detailed work arrangement, and also ask all the departments at all levels to put the control and prevention of the outbreak as the top priority, and we also organize the leadership, and also identify the roles and the responsibilities. And we also make 7 requirements. First, we should really realize this is an important outbreak, and we should make the work solidly, and we should make the implement to detail related, and we also need to have the good allocation, and also we need to have the roles and the responsibility clearly, and also make sure we have enough supplies. And second, we also organize the meetings in Hubei regarding the sectors of tourism and culture, and also talk to the traveling agencies, so to understand the work going on here in Hubei, and we also had the trained the leader of the tourist group, and also make the notice to the tourism teams. The January 21st, to all the tourist groups to other cities of China, to the other countries, and also to the traveling teams to Hubei, we obtain all the information. And third, we have a concrete work plan. Based on the current developing situation, we strengthened our effort to control the activities conducted in our sectors. We also had 6 requirements. Talking about the performance, we all suspended or cancelled. Prefecture level and above, all the venues holding the cultural activities all stopped, and the tourism class A places or the people-intense places all suspended, and also the place for entertainment all suspended. And for the other places, they need to check the people's body temperature. If necessary, they should also stop their operation. All the touring agencies, they should stop their work and not organize the tourism teams. If already organized, they should suspend it or cancel, and also deal with the refund. So all the places should implement the arrangements based on the command center. And fourth, we also established the work mechanism, and we had the leadership, and we have the top leaders taking the key roles. And we also have the emergency systems, and also have the specific people to deal with specific work, and also have the information reporting mechanism, and also have the reports systems, so we can get the information updated in a timely manner from different places in Hubei. Make sure we can understand the developing situation. And for more information, we will release to you in a proper manner. Thank you, Mr. Xu. Now, I will give floor to Mr. Chen talking about the market control. Friends from the media, good evening. And thank you for your interest in the market supervision work. So today, I would like to introduce about the work conducted in the market supervision sector. Started from the end of December, we mainly focus on three things. Number one, we strengthened our supervision on catering sector. Second, and we also conduct work on the control of the safety of online food safety. And also third, the agricultural market also our key priority. Regarding the agricultural market, we had 8 supervision teams. So we conducted the medium and large size of markets to look at the food safety, to look at the their environment, and also other the 23 areas, and also found the 277 places for improvement, and also reported back to the command center, and also make the improvement plan. And second, we established the emergency mechanism. We had the level 2 emergency system initiated with the bigger picture in mind. Under the leadership of the provincial government, we had 8 measures in place. Number one, we released timely the measures in terms of control and the prevention, especially strengthen our work on the supervision of the agricultural market. And second, we also had a frequent check on the catering sectors. And the third, we also monitor the price. Fourth, we also strengthen our efforts on the wild animal markets checking. And also number 5, we strengthen our efforts on the checking of the online food safety. And 6, we protect the consumers' legitimate rights and interests. And we also have the complaint systems in place. And 8, we had the punishment measures in place. So under these 8 measures, we have our working plan. Number 1, we monitor the market price regarding the masks and other medical supplies. In recent days, the medical purpose masks, actually the price fluctuated. So we check the price, and also under our key focus. On the morning of January 22nd, the provincial government also gave the guidance and asked the suppliers should supply the reasonable price and service. That should be reasonable and should be transparent. And you cannot stock the masks in order to increase the masks. And it's not allowed to drive up the price of the mask. And also, it's our job to monitor and make the price stable. Yesterday, Wuhan also, government also released the requirements. So today, we conduct the checking work on the markets and the supermarket, grocery stores. And so the price right now overall is stable. And on January 2nd, 九州通国药能服医药上药湖北 Nanjing Yiyao Hubei and other large pharmaceutical producers. We had meetings with them, make sure they shoulder the due responsibilities, and also is forbidden to stocking the masks and driving up the price. So they make their commitment to the public and also work hard to allocate the masks, make sure we have enough supply. And second, we also monitor the agricultural products price. On the morning of January 23rd, we received the feedback on the price increasing of the agricultural products. So we led the team to check the fact, and also we asked the suppliers of the agricultural products, ask them to make sure the price is stable, and we also sent 13 teams to different districts in Wuhan to monitoring the agricultural products in the supermarket and other markets to see whether the price fluctuation or not. So based on our observation, we found that people rush to purchase agricultural products. We have some shortage of the agricultural products. Otherwise, the price is controllable and stable. And look at the online products. So we also monitored the online platform, make sure the key medical needed products, their price is stable, and make sure there's no fake news flying around. And also conduct a spot check on hospitals. We have around 100 rounds of the spot check. That's all randomly. And also we look at the elevator management, make sure we clean and sterilize the elevators. That should be conducted every day. And third, we also check on the accuracy of the body temperature detectors. So for the detection reagent, we also check whether they're accurate or not. And fourth, we also check the online purchase that should be fair and just and transparency. And we also had the hotline 12315 for complaint. And for our next step, we make sure that the price of the necessity is stable and make sure the supply is sufficient. And third, we strengthen our work on education the public and also give the feedback to people's interested questions. Thank you, Mr. Chen. Now I would like to give the floor to Dr. Hu Ke. Friends from the media, good evening. Based on the Hubei Municipal Health Commission requirement, we organize the experts and also work under the guidance of the control and the prevention of the coronavirus related pneumonia, and we released the first edition of the treatment. I would like to tell you the guidance. That's our first edition in this regard. So the guidance is to aim on the medical work on the control and the prevention of the coronavirus. That's based on the National Health Commission guidance. So we summarize the related information and also based on the current cases in Hubei province. So it's practical and also efficient. So we released this first edition of the guidance. So it's divided in different parts. First, it introduced about the what is the coronavirus. So that's in line with the national level. So that's more related to the etiology. And we also talk about the feature of the coronavirus. So that's based on the clinic features. So in the guidance, they talk about the majority cases. As first, they have the fever, cough, and after 1 week, they also quite feeling hard of breath or the shortness of breath. So we talk about at the very beginning, at the initial stage, they may not have a fever or high fever, and they recovered after 1 week. So some patients, based on our clinical cases, that's also varied. So that's all summarized, included in the guidance. And we talk about at the initial stage, we will also check their lymphocytes. And we also check with the iconography to check the color of the lung. And we also talk about their medical cases. First, based on our observation, another is based on our confirmed cases. So right now, the release, the first edition of the guidance, it's based on our epidemiology and also based on the cases this time is the confirmed cases that people contacted with the people from Wuhan. So this is something different from the national release guidance. Talking about suspected cases, we also included in the consideration of their clinical features, that's including their initial stage. We look at their numbers of the lymphocyte, and that should be all released on the etiology. And we also look at the sequence. We should say whether that should be their sequencing in line with the coronavirus. And we look at the cases with the critical or serious conditions. That's all included in the guidance. That's all aligned with the national level. And we talk about diagnosis level, that the measures that also included inside. That should also help the people to identify from SARS, MERS, that's also the unknown diseases or the respiratory diseases, influenza, and also that help us to distinguish from other infectious or non-infectious diseases. Fifth, we talk about the case discovered and reported. We talk about suspected cases. Should have the 2 times. That's their nucleic acid test positive. It should be 1 day. They should be conduct this test twice, and that twice all showed positive sign. Then we can confirm that's the coronavirus confirmed case. We talk about suspected cases or confirmed cases. Should be receive the quarantine medical treatment. And for the suspected cases that should be hospitalized in single room, the ICU should receive the patients with critical conditions. For more details regarding treatment, due to the interest of time, I will not read out everything. So this is the first edition of the treatment guidance released by Hubei. And we also emphasize the role of traditional Chinese medicine. So based on the clinic features of coronavirus, so that can be used the TCM. And that can be received the treatment by TCM for the concrete plan. I will not read them out. But we have the clear requirements and the definition in this regard. We talk about the temperature back to the normal level and the long. The iconography is healthy, and also they should conduct a nucleic acid test, as also showed 2 times of the negative, that then can be discharged from the hospital. And we also have the related guidance regarding the transferring to other hospitals, so you can follow the guidance. So that's the first edition of the new type of coronavirus medical treatment guidance released by Hubei province. So based on the development of the virus, we will summarize the clinic experience and also update the guidance, especially based on the lessons we learned from a clinic and also the etiology, and we will release the updated version in a proper time manner. Thank you. Thank you, Mr. Hu. And now the floor is open to take your question. And please raise your hands and also identify your media outlet before asking questions. The China News Agency. My question regarding the market supervision. So what's the measures you will take? So talking about the market supervision department, we give the notice and the warnings to the public. And we also will conduct a daily checking, market checking. And once we receive the complaint from the public, we will deal with it timely. And we also welcome the public, the society, and please call the hotline 12315. So we will utilize this platform to receive your complaint and your interested questions. And we will also strictly punish illegal behavior of the suppliers. So we will strengthen our efforts on our daily checking. Right now, we're quite sensitive on the pricing. So this is our key focus. So our role is that we conducted the overhaul in this regard in the different markets, supermarkets, grocery store, and we also conducted the spot check and also the random check. For the wrongdoing, we will also give them punishment. Thank you. So my question regarding the tourism. So for the museum and other cultural or entertainment venue, we still see some staff working in these venues. So how you manage the staffs? Thank you. We talk about the Spring Festival, the Chinese Spring Festival, actually the peak season for tourism, and also the peak season for cultural activities. After the outbreak, we conduct the meetings. At the very beginning, we give the requirements to all the cultural and venues to give them the requirements on the control and prevention of the coronavirus, and also they should have the ventilation quite often, and also to sterilize the venue, and also to cut the performance or activities. And also give out the notice to the public. And we will strengthen our efforts on the control and the prevention of the epidemic. So for the key cultural venues like the museum and the library, we will close them. Besides Wuhan, for the other places in the Hubei province, so based on the localities requirement, they will also close these cultural venues. Talking about the tourism, the scenic areas. So we will also strengthen our efforts on the prevention and the control, and also the tourism platforms. We also ask them to stop organizing the tourism teams. And also for the scenic areas, they will also not sell tickets. And for the key performance in scenic areas, that's also under control. For the large-scale performance, because they originally arranged a lot of performance to celebrate the New Year. For these performance, should be cancelled or delayed. All in all, based on the command center's requirement, we'll strengthen our efforts to create a safe environment and also strengthen our efforts on the epidemic control and prevention. Due to the interest of time, coming to the end of the press conference, so tomorrow afternoon at 3:30 local time, we will also have our daily press conference. That's the end of the presser. So please protect yourself. Thank you.